Hi, I'm Dr. Natacha Simpkins from Town & Country Animal Hospital. Today I'm going to talk to you about endocrine diseases in cats, specifically hyperthyroid disease and diabetes, which are the two most common diseases that affect cats. So endocrine diseases are conditions that cause hormonal imbalances in the body, causes the body to not function properly. In cats, the most common endocrine diseases are hyperparathyroidism and diabetes mellitus. Cats that have diabetes tend to drink more, urinate more, they have an increased appetite, and they have weight loss. Diabetes is actually a straightforward thing to diagnose. We just do blood testing and urine testing, and so we can diagnose it quite easily. The treatment at home for diabetes is insulin and then high protein, low carbohydrate, canned cat food. So there are specific prescription cat foods for diabetic cats that can be really helpful in lowering the amount of insulin they need. Is an oversecretion of thyroid hormone. And when thyroid hormone is oversecreted, the cat becomes hypermetabolic. They drink more, they urinate more, they have more energy, their heart beats faster and harder. They can occasionally vomit. They will lose weight despite eating more. And sometimes their hair coat will change. They will not be grooming as well. It can be more aggressive as well. Hyperthyroidism is easy to treat. The main way that we treat is with an oral drug called methimazole. It's given twice daily. We generally follow up with recheck blood work to make sure we are giving them the appropriate dose. And that is a very good medication which normalizes thyroid levels. The other way that is ideal and kind of the gold standard for treatment is radioiodine therapy. And it has to be given at a different location than your general practitioner's office because it's a radioactive substance and it needs to be handled specially. Hyperthyroid disease is diagnosed with blood work. It's a relatively straightforward diagnosis. Most cases have an elevated T4 result, which is on a common chemistry CBC senior panel. Every now and then they're borderline, and with those we might want to do further testing. A lot of cats become hyperthyroid. The average age is around 13 years of age. The longer they live, the more likely that they are to possibly develop this disease. I personally really like 6-month exams for senior cats because what we do when we examine them every 6 months is we're looking for these symptoms, which are very obvious to us, but might not be obvious to the cat owner. For us, they always have some weight loss. Their coat, we'll notice, is not as nice. They'll develop sometimes a quiet heart murmur before there are any other symptoms. And the weight loss is really hard to see at home because they're still eating well. So everybody assumes that they're not losing weight. But we put them on our baby scale and we see that 1 pound, 2 pound of weight loss, and it's a lot of the time very surprising for the owners. So that's why I think physical exams are great, because if we have that index of suspicion, we can easily test for it. It is treatable, and then they can go back to normal. They can gain weight and be happy and satiated when they eat again. Their drinking, urination decreases, their vomiting stops. So it's a very rewarding disease to treat. Thank you for watching the video today. I hope you learned a little bit more about diabetes and hyperthyroid disease in cats. If you have any questions, please don't hesitate to reach out to us.